Staying healthy today, a 34-year study shows advanced breast cancer has increased slightly among women ages 25 to 39. The results are potentially worrisome because some young women's tumors tend to be more aggressive than older women's tumors, and this group is less likely to get the routine screening or to be covered by insurance for screening. The authors say this could be because of a rise in obesity or genetics, but they say more research does need to be done. Earlier this week, we talked about a new study which found Mediterranean diets rich in olive oils, nuts, fish, salad, and wine are better for your heart than low-fat diets. We want to take a closer look at the findings now.
Dr. Dianne McCallister is joining us now. She's been looking into all this. We've heard about the Mediterranean diet for a long time, but the study's new. What is it showing now?
So this is a study that was done in Spain on 8,713 people. So this is a very large, good study. And what they did is they took high-risk patients for heart disease who did not currently have it, and they put them on 3 different diets. One diet was a Mediterranean diet with a supplement of nuts. One was the Mediterranean diet with a supplement of olive oil, and then a low-fat diet. Over a 4.8-year period, what they found is that the 2 groups who are on the Mediterranean diet had significantly less cardiovascular events than the people on the low-fat diet.
We have Gabby Gourmet and a number of professional gourmet chefs in the studio right now, and they're hanging on your every word about this. Now, the researchers found a pretty big difference between the low-fat diet and the Mediterranean diet. Can you explain that?
They did. There was a 30% reduction in coronary events if you were on the Mediterranean diet compared to the low-fat diet, which is one of the standard diets we use for heart disease. So that means less events in these very high-risk people.
Remind us what's in the Mediterranean diet.
So the Mediterranean diet, as was mentioned, is very high in fruits and vegetables. It's very high in grains. It's low in dairy, low in red meats. It has some fish and chicken, and then a little bit of wine, a glass of wine with food.
A little bit of wine.
So what does this study, this new study, add to our body of knowledge about the heart?
So I think one of the things is that this really points out that the Mediterranean diet, at least in these high-risk people, is better than low-fat diet, so we want to steer more that way. And it really goes along with the research that we've heard before about blue zones, where in the Mediterranean at Sicily, where people eat plant-based diets, they tend to have longevity.
Okay, so now we know.
Yeah,
right.
So add an apple a day. It does keep the doctor away.
Okay.
Very good.
Thank you so much, Dianne. And, of course, Dr. Dianne McCallister is the Chief Medical Officer at Centura's Porter Adventist Hospital, and she joins us here on Wednesdays.
On Wednesdays.